new eligibles, new opportunity, new demands. This is section 4 of the 5-part webinar. If you haven't already, I encourage you to check out other sections of this webinar for a more complete picture of the new opportunities and new demands for the new eligibles. My name is Doreen Allen with Santiago Solutions Group, and I will share with you section 4 of this 5-part webinar, which focuses on building customer intimacy with the newly insured, new customer experience demands for insurers and hospitals. Building on what we've heard on ACA system complexities, the need for cultural nuances, issues around value perceptions, and more, we see that at each touch point of adoption and engagement, any stumbling block can be disruptive and scary, and potential enrollees will drop off. The complexity of new terms, the distrust levels of unknown players, and negative word of mouth, the customer experience being inconsistent with slow or limited services in Spanish, and issues with perceived value for both millennials and Hispanics means that when the customer does finally arrive to us as an insurer or service provider, feeding in from the exchange, customers arrive in an already influenced state of mind. So how do we address this from both an acquisition as well as a retention perspective? As an insurer or hospital, what do I need to do to ensure a more positive customer experience? Knowing your customer and understanding their needs increases customer intimacy, which improves customer loyalty, resulting in higher retention and more referrals or brand advocacy. And unfortunately, our status quo is not good enough, given the experiences this customer has had through the exchange process. We now need to rise above and turn their experience around. Insurers and hospitals will need to overcome customers' prior negative experiences and reassure on the touch points we can control to avoid a flood of customers exiting at the next open enrollment. So what can we do as an insurer or hospital? Since we cannot boil the ocean due to our limited resources, we can focus on 2 key fundamentals to help our customers. Simple is the operative word, keeping both our communications and the journey as simple and clear as possible. Even starting from the acquisition perspective, knowing what type of customer we would like to attract and messaging appropriately in a clear manner, perhaps pulling from that fertile ground on attracting those with a healthier mindset and therefore more open to insurance coverage. Then, knowing that many of these customers may be less experienced with healthcare and not as clear as to the processes, so the adjustments we need to make to provide a good customer experience fall under the umbrella of increased clarity. With such steps as a user-friendly onboarding process, carefully scripted responses at the contact center, and easy-to-understand FAQs online. Perhaps relating the steps in health insurance to a process that they may already understand, like handling a car insurance claim, working to create that empathy with our customer and reducing the fear. To reduce customer effort and channel switching, testing online and mobile apps to be sure our links work. It may sound like a no-brainer, but how many of us have experienced that frustration with other services? Millennials are always on the move and on mobile devices. If it doesn't work, they tend to be impatient or will be interrupted and move on, maybe not returning. We've lost our chance with them. Interestingly, being involved in the community becomes higher in importance now as well, so our brand name becomes even more trusted. And as we hear firsthand about experiences of customers and potential customers, we know what fixes may be needed in our processes and communications with our customers. Quarterly or once-a-year customer satisfaction surveys are not real-time enough for the new paradigm. And because our clients as SSG are often running with other internal priorities, SSG as an external extension of the team has helped clients to create a more satisfactory customer experience by auditing all the touch points along the customer journey, identifying those that are the most important to the customer, and working with our clients to find operational and communications fixes in a prioritized fashion, all to facilitate that smoother customer experience journey. As you can see, as insurers or hospitals, there are specific opportunities to overcome some of the customer experience fears Hispanics and millennials have faced and turn them into loyal customers of our brand. Our job now is to focus on truly understanding their needs and keeping our communications and their customer journey as simple, trouble-free, and clear as possible. This concludes section 4 of the webinar. Please feel free to access other sections of this webinar on ACA 2.0. Also, I invite you to subscribe to our monthly newsletter and to follow us on Twitter and LinkedIn for additional actionable insights. Thank you.